Hello everyone. We're going to talk about understanding allergy. This chart really explains a lot about allergy. When someone says, I have sinus allergies or I have allergies, what do you mean you have allergies? So this is what I mean. Allergies are things in the air. Could be pollen, dust, environmental allergens. Things in the air like pollens. You breathe it in, it attaches to the nasal spray, the nasal mucosa, and the nasal mucosa, it will react to the allergens in the air. When you react to them, you're a person that have allergies. When you don't react to them, you don't have allergies. So when you react to them, what happened? There's a chain of reactions happen. So when the pollen get exposed to the sinus mucous membrane, it react. This is the antigen or the pollen. It affects the white cells here. They call them the B cells. It changes it to a plasma cell, and the plasma cell produces changes lead to a mast cell. The mast cell releases histamine, and histamine, when it get released, it causes the congestion, the inflammation, the runny nose, and the drippiness, and the symptoms. So different medicine, if you say what is better for the allergies, to use this medicine or that medicine, or what is the best thing to do the allergies, generally speaking, as a family physician practicing for the last 30 plus years, the best thing for the allergies, I would use two products over the counter. I did a videos about it before, you can check it out. Is the best thing to do is I would start with doing sinus rinse. What does the sinus rinse do? The sinus rinse, basically, it rinses out the pollens from your sinuses. So you wash them away. So you have less exposure. So this reduces the exposure to the allergens. You do that every day or twice a day. In addition to the sinus allergies, I would use the Flonase nasal spray. Flonase nasal spray, you spray it on the sinus mucosa. It reduces the inflammation, the reaction to the allergens. So you have less swelling, less inflammation, less reaction. 9 out of 10, these are the best thing to do, and it covers most people's allergies. Now, let's say I'm doing these things regularly. What else I can do? I would say, you know what? I can give you ipratropium nasal spray to use it as needed. What does that do? It doesn't work at this stage. It works here at the very end. When the histamine get released, affect the mucous membrane, this will block the congestion. It's a decongestant, so it will reduce the congestion and hence the drippiness and the mucus production. What else can I do? How about Zyrtec? Does it work? Yes, it works. The Zyrtec, it blocks the histamine when it get released. So see, it doesn't block none of these steps. Different medicine, different methods work on different steps. So if you use the Zyrtec, that will block the histamine from affecting the mucous membrane. But it's not a foolproof. It's not 100% block. It will reduce the symptoms, but it doesn't reduce the symptoms as much as if you use the Flonase and the nasal and the sinus rinse. What else can I do? Well, you can do a decongestant, which is like ipratropium. It's a decongestant, but this is Sudafed. It blocks the congestion, but that comes in a pill. Side effect of this is palpitation, affect your heart, affect your blood pressure. So you have to be careful using this. The side effect of ipratropium, it's really rare. It could affect your pupil, or if you have a uneven pupil or constriction in the pupil in the eye, and it might affect the pressure inside the eye. So we're using nasal spray, but it could affect the eye. What else could we use? Let's say I'm using all these things and I still have symptoms. What I like to use? I could add single layer. Single layer, it works on blocking these steps from here to here to here to here. These steps are intermediated by leukotrienes, and this is a leukotriene inhibitor. Single layer is a pill once a day, 10 milligram. It will help block these things. So allergies, medicine, each one does a different thing. You could use, someone that have bad allergies could be using all these modalities to reduce their symptoms. And it could be with all these modalities, they still have symptoms. So here's a chart showing allergies. When people say, I have seasonal allergies, what does that mean they have seasonal allergies? Let's say a person that have allergies, a person could have allergies. Let's say this person have allergies to everything on the chart. Trees, grass, ragweed, and dust mite. Dust mite it's another video. It's for It's a creature, little bugs in your mattress, in your pillows, in every mattress, every pillow. You cannot get rid of them. They're part of our life. They feed on our skin, sloughed skin cells. So that is all year long, all year round. Ragweed, let's say between this month and this month. Grass between this month and this month. Different regions have different timing. If a person is allergic to everything here, then what time all these line up together? Probably this time more things line up together. They will have the worst allergies in the year. This time they'll have only dust mite allergies, so they have less allergies, just dust mite. In January they only have dust mite, and this they have everything lined up. They'll have allergies to everything. So it really depends what you're allergic to. If you're allergic to dust mite, there's other things you can do, like hypoallergenic sheets on your mattress and pillow. Not what you cover yourself with, on the mattress and pillow, to lock them in and don't let the dust mite come for you to breathe them in. So that is the allergy treatment. Sometime, okay, a patient came with a flare-up. What can I do? I might give him a steroid, either pills or a shot. The shot, my favorite shot to give is the Depomedrol, which is a shot good for 3 to 4 weeks to reduce the response of the allergies. It inhibits most of these steps. I did not show the steroids, but inhibits most of these steps to give you like a break from allergy and allergy response. But for people that have allergies, I think, in my opinion, they should be using the fluticasone nasal spray and the sinus rinse every day. Whether you have symptoms or not, you do it every single day, nonstop. These things, you can add them. It depends on the time of the year, depending on the situation, you could add them. But this is a summary for allergy treatment.